On the last episode of Dialogues in Multiple Myeloma, we met Tony, who shared his diagnosis journey and treatment success story following CAR T therapy.
And after talking about it and going through it in May of this year, in 2025, and saw you on Monday of this week, and you shared with me that I was MRD negative and pretty much cancer-free.
In this episode, Tony discusses his emotional journey as he processes his CAR T therapy success with his oncologist, Dr. Peter Voorhees.
I think mentally for me as well, not knowing if this was really going to work, because again, having that chemo as your cushion for so long, for almost 12 years, and now that you've had Carvykti and you're thinking, well, I'm not going to infusion to take anything, I'm not taking chemo, so is it really keeping the cancer at bay? Is it really working to fight this off? And to get that news, like, yes, it's working. You are MRD negative. It's not there. Like, you're good. This could be my cure. So it's really phenomenal to hear, because it's something that I still can't process. It still doesn't seem real to me that I am MRD negative, because I have been doing this for so long. So I was very intentional about having a therapy session with my therapist right after your appointment. Just whether it went good or bad, I needed to talk to someone about that. And she kind of described it as reverse grief. It's going to be months, possibly years, for me to understand it. Hearing you have a terminal cancer, even at the very beginning, you think, well, I'm going to have this forever. There's not a cure for it. So still this cloud in my head that follows me is still saying, you are great now today, Tony. Everything looks good. It's wonderful. Yes, I'm going to celebrate it. I'm going to bask in it. But I will be lying to you if I didn't say, I hope I do get 5 or more years out of this, but could it possibly come back in a year? Will I be back? We talking about doing something else later. It's hard to separate that when you've been dealing with it for so long and you have this diagnosis over your head.
Yeah. And I think your experience is very much in line with the experience of many patients who've been through CAR T-cell therapy. This idea of being off therapy is liberating, not having, to deal with chronic side effects of therapy, but at the same time, that cycle after cycle after cycle almost served as a crutch, and to be off of that all of a sudden, you're like, well, wait a minute, you're not doing anything to treat my multiple myeloma. But the important thing to recognize is that those CAR T cells go in there, and they grow, they expand, and they go out there and they seek out, your myeloma cells, and they destroy them. And they will persist in your system for some period of time. And the other thing that's important to recognize is that in the original study that led to the first FDA approval of Carvykti, for example, and then the revision to the FDA approval when the CARTITUDE-4 study was released and we were allowed to use it for earlier relapse, none of those patients got chemotherapy after their Carvykti, yet they're doing great. In the original CARTITUDE-1 study, we had long-term follow-up that we presented earlier this year, and in that very heavily pretreated group of patients, a third of the patients still had not relapsed 5 years after Carvykti, not having received a single drop of myeloma therapy subsequently. And for those patients, 5 years out from their Carvykti infusion who are still in remission, when you did a deep dive into their disease with MRD testing, PET-CT imaging, etc., we weren't able to find it. And for the first time, people are starting to talk about cure. Now, I think we'll have to monitor patients who've been on the Carvykti studies for a long period of time before providers like me are comfortable using that word on a regular basis in front of myeloma patients. But no one would question the fact that we are seeing unprecedented outcomes with this type of therapy that we just never saw before.
I think that's absolutely phenomenal, and it's so good to hear you keep reiterating that to me. I need for you to keep saying that to me when I'm in your room and for a visit to see you. I think that's because that helps me psychologically to know, like, Tony, you're okay, like all is going to be well. So thank you.
Absolutely.
I think once I'm no longer going into an infusion center, like it'll start to really sink in for me. I don't know if this is an option, but I'll ask anyway. Like, is there a way, like, because for me, when I hear the beeping and I smell it when I go, like, I know what it smells like in an infusion center. I hear the beeps. I see the people around me. They're sick. I see the lab draws, all the tubes. So that for me is such a trigger where I'm still like, I'm going into a treatment facility for chemo. I'm like, is that something that would ever be provided in the pipeline to be done in a hospital setting, like not hospital setting, but more in a room setting that's not in an infusion center?
Yeah, actually, and just for folks listening, the IVIG or intravenous immunoglobulin infusion requirements after BCMA targeted CAR T-cell therapies like Carvykti and Abecma, which is the other FDA approved CAR T-cell product for myeloma patients. You know, these weaponized T-cells are very good at killing multiple myeloma cells, but they don't do a great job of making a distinction between a cancerous plasma cell of myeloma and a normal plasma cell of your immune system. So there is a period of time after Carvykti CAR T-cell therapy or any BCMA-targeted CAR T-cell therapy where we've reduced the levels of normal plasma cells in your body, and that leads to low antibody production. So that does make you vulnerable to certain types of infections, particularly respiratory tract infections. So we basically give you an infusion of IgG or IVIG once a month to restore those antibody levels to a normal level and reduce the risk of those sorts of infection. The good news is that, one, your normal plasma cells are going to recover. The time at which that takes to recover varies from one patient to the next. In our experience, it can take anywhere from 1.5 to 2 years. We may be able to space out the frequency. I mean, right now it's monthly. We may be able to do it less frequently as time goes on and as your normal plasma cell pool starts to repopulate. But the overwhelming likelihood is that you will get off of IVIG eventually. And we found that when we used Carvykti earlier in the treatment continuum, it seems that the normal plasma cell pool tends to repopulate faster. The other piece, and we can look into insurance about this, because insurance is the primary driver of how we administer IVIG. There's the option to have a home health agency infuse it intravenously at your home one day a month, so that's a possibility. There's also subcutaneous injectable versions of IVIG that can be administered at home as well. Now again, this is an insurance-driven thing, but we could query your insurance to see if it would cover home health services and IVIG infusions at home or the subcutaneous preparations of IVIG. So there is a way to do this outside of the infusion center and outside of the hospital altogether.
Oh, that's excellent. I'm glad I brought that to your attention then, because that would be excellent. And I'll definitely will leave the viewers who are listening that, just stay positive, give yourself some grace, and know that you're going to get through this. It's been almost 12 years for me, and I am thriving. And find yourself a great specialist if you don't have one. I think that's very critical.
Stay tuned for more episodes of Dialogues in Multiple Myeloma.